My name is Sarah Tabrizi. I'm a Professor of Clinical Neurology at the Institute of Neurology at University College London. This project I'm going to tell you about is with Chris Clark and is trying to understand the connections between the basal ganglia and regions of the cortex in the brain. We're going to study patients who carry the gene for Huntington's disease, which is an inherited neurodegenerative condition. We're studying people many years before they show signs or symptoms of the disease and they're completely well. We're going to be analysing their brain structural images and trying to understand the changes that occur in their brains. In particular, the changes in alterations in connections between the basal ganglia and the cortex. If we understand how the alterations in connections between the basal ganglia and the cortex contribute to disease progression and disease symptoms and onset in Huntington's disease, then we can use this for development of therapies where we hope that therapies will restore the connections or stop the connections being broken down. And so it's pivotal for us to be able to understand how different parts of the brain are communicating and connecting with each other, such that we can use this as a measure of how effective our potential therapies are being before people have onset of the disease. I'm now going to hand you over to Chris Clark, who I'm doing this work with, and he's going to tell you about the imaging and computing side of this exciting project.
My name is Chris Clark. I lead the Imaging and Biophysics unit at the Institute of Child Health and specialise in imaging the brain using MRI. In particular, I specialise in a technique called diffusion imaging, which allows us to look at the connectivity of the brain by studying how water moves and diffuses around in the brain structure. This particular project is concerned with a devastating neurological condition called Huntington's disease, which causes degeneration of the brain structure. So we're interested in developing and using these tractography methods to look at how disconnection happens in the brain, i.e. Loss of connectivity between cortical brain areas and between the cortex and particular structures in the brain called the basal ganglia. This can give us clues to how the degeneration process occurs and how it relates to disability in Huntington's disease. So UCL is the largest academic institution in the world conducting studies in neuroimaging. It's a centre of excellence. It has a very large program based at the Institute of Neurology studying Huntington's disease. So this is an ideal place to undertake this project because it has both strength in the clinical side of the project, and it has of course a very strong base in the methods side of the project, specifically in diffusion imaging and tractography.